Good afternoon. Thank you for joining the webinar. My name is Cynthia Thaler, and I'm a Program Associate at the Council of State Governments Justice Center. Before turning to the content of the webinar, I'd like to briefly talk through a couple of housekeeping items about how the webinar is going to work, and then take a brief moment to tell you about the Council of State Governments Justice Center and the National Reentry Resource Center. Anytime during this webinar, you may ask a question by typing it into the Q&A panel on the bottom right-hand portion of your screen. We will keep a running list of the content-related questions we receive and then ask the panelists to respond to the questions during the last segment of the webinar. We will do our best to get through as many questions as possible. If you encounter technical or audio problems during this webinar, please call WebEx Technical Support at 866-229-3239. Please understand that there are some technical issues you may not be able to resolve, and for this reason, we're recording this event and we'll post it on our website at csgjusticecenter.org/NRRC. The Council of State Governments Justice Center is a national nonprofit that serves policymakers at the local, state, and federal levels from all branches of government. Staff provide practical, nonpartisan advice and consensus-driven strategies informed by available evidence to increase public safety and strengthen community. The Second Chance Act, which was signed into law in 2008, is the first federal legislation passed by Congress to authorize federal support for reentry programs. The bill authorized up to $165 million in federal grants to state, local, and tribal government agencies and nonprofit organizations. In 2009, following a competitive process, the CSG Justice Center was selected to launch the National Reentry Resource Center and provide training and technical assistance to all Second Chance Act grantees. The National Reentry Resource Center is administered by the Council of State Governments Justice Center in partnership with the Bureau of Justice Assistance, U.S. Department of Justice. The National Reentry Resource Center is also leading a number of projects centered on changing the conversation about the reentry of adults convicted of sex offenses. For more information on this work, please visit the Reentry webpage on our website to find webinars and reports that discuss the ways in which evidence-based programming can help improve outcomes and better integrate individuals with sexual offense convictions into broader reentry strategies. The Justice Center's youth program provides state and local policymakers with comprehensive research, analysis, and technical assistance that support collaborative and consensus-based strategies that reduce recidivism, improve school discipline practices, and incorporate the appropriate behavioral health interventions for youth and their families. The Justice Center is constantly adding new content and resources to the website, and we send out a monthly newsletter that provides information about the latest research, funding opportunities, distance learning events, and other news about reentry. To sign up for our newsletter, please visit csgjusticecenter.org/subscribe. Today's webinar will be part of a larger series, so please stay tuned for more webinars in the series. Webinar topics will be driven by questions we receive from the field and what is actually being experienced on the ground. In this webinar, we will be discussing what works to promote reentry success for youth convicted of sex offenses. We are very fortunate to have representatives from the Illinois Juvenile Justice Commission on the webinar today, and they will share their experience improving Illinois' response to sex offenses committed by youth. That presentation will be followed by a presentation of what we know based on the research on juveniles who commit sex offenses. And finally, we will have time to address any questions you may have for today's presenters. As stated earlier, we encourage you to type any questions into the box on the bottom right-hand corner of your screen at any time during the webinar. Joining us from the Illinois Juvenile Justice Commission, we have Robert Vickery, who is the Executive Director of the Illinois Juvenile Justice Commission and the state's Juvenile Justice Specialist. Before joining the Commission, Mr. Vickery worked as in a local probation department as a probation officer and later managed probation programs for both youth and adult offenders. Also joining us is Lisa Jacobs. Ms. Jacobs is Vice Chair of the Illinois Juvenile Justice Commission. She currently directs the Illinois Models for Change initiative, which is funded by the John D. and Catherine T. MacArthur Foundation and managed by Loyola University School of Law. In this capacity, Ms. Jacobs works with state and local justice systems, practitioners, advocates, and policymakers to implement positive policy and practice changes in the Illinois justice system. The Honorable Judge George Timberlake is Chair of the Illinois Juvenile Justice Commission and a board member of the Illinois Juvenile Justice Initiative. He's also a member of the Illinois Juvenile Justice Leadership Council and the Redeploy Illinois Oversight Board, as well as the Federal Advisory Committee on Juvenile Justice. Judge Timberlake was a trial court judge for 23 years before his 2006 retirement as Chief Judge of Illinois' 2nd Judicial Circuit. Finally, we will hear a presentation concerning the research on juveniles who commit sex offenses from Christopher Labanov-Rostovsky. Mr. Labanov-Rostovsky has worked for the Division of Criminal Justice within the Colorado Department of Public Safety as the Program Manager for the Colorado Sex Offender Management Board since 2006. He also works as a private consultant for a variety of federal, state, tribal, and private agencies in developing and enhancing sex offender management services and has published a number of articles and chapters related to the federal and state sex offender management public policy. Thank you to today's presenters for participating on today's webinar. And with that, I'll now turn to Lisa Jacobs, Robert Vickery, and the Honorable Judge George Timberlake. Thank you for presenting on today's webinar.
Thank you so much. This is Rob Vickery, and I'm in the same room with Lisa Jacobs, and we're going to start our presentation today. What we're going to focus on more than anything else is a particular research process and policy evaluation process that we went through over the past couple of years in response to a particular request from our legislature. We're not really presenting ourselves as experts in every aspect of working with sex offenders, but we do think that the process that we engaged in, the questions we asked, the way we went about asking them and answering them, and the recommendations that resulted will hopefully be useful to all of you and definitely have implications for reentry practice. So Public Act 97-0163 asked us to do this study, essentially looking at what it would take for Illinois to provide effective treatment and supervision for juvenile sex offenders. So we, as the Commission, were asked to do this study. We're called the Juvenile Justice Commission, but we are filling the role of the State Advisory Group as defined by the Department of Justice and the Office of Juvenile Justice Delinquency Prevention. So with that federal role, we have a planning component. We administer some federal grant dollars, and we also ensure compliance with core requirements around conditions for youth who are in custody and for reducing disproportionate minority contact. In Illinois, that means that we also have some Illinois state policy responsibilities. We have a statutory responsibility to provide advice to the governor and the General Assembly. And it was really in that role that we were asked to do this study.
Good afternoon. This is Lisa Jacobs. And the slide that you see here just provides a bit of the context for when the Juvenile Justice Commission launched this study. as Rob said, what we think is significant about the study is the way we approached providing policymakers and practitioners with current, solid, objective information about youth who have committed sex offenses and the extent to which our policies and practices are or are not aligned with what we believe to be best practice based on research and data. As Rob indicated, our study came out of a legislative mandate to the Commission to look at this issue and provide information back. And that legislative mandate grew out of the fact that in Illinois, as in many, if not most states, the number and scope and complexity of laws governing sex offenses in general and governing youth who have committed sex offenses has been growing and becoming more and more complicated. So when we sat down to launch and design this study, there were laws on the books dating back 30 years regarding adults who had committed sex offenses, and beginning in 1999 for Illinois was really when our legislature had started to explicitly include youth in those laws regarding sex offending and the consequences that would arise from them. It was a patchwork of laws in Illinois, as we think is present in many states. Each year, more and more statutes were added without necessarily tailoring them, revising past laws, or making sure that they had matched previous statutes. So we had a lot of laws on the books in Illinois, and there was a lot of confusion about what actually those laws required and what they said, both among policymakers themselves, but also as we dived into the study, we found that there was a lot of confusion about the state of law regarding youth who've committed sex offenses among practitioners, frontline practitioners from law enforcement to probation officers, public defenders, judges, and service providers. And there was even confusion among people whose job it was to advise youth about the laws pertaining to them if they had been adjudicated delinquent for a sex offense. And as I indicated, more and more frequently in Illinois, we were seeing youth lumped in with adults, adult offenders, and the statutory requirements that govern them. On the other hand, there was also promise, and that's the last bullet you see on that slide, which is that we also knew since 1999, for example, there was a wealth of new research, new information, and new tools to help us understand and to help policymakers understand the origins and the characteristics of youth with problem sexual behaviors, how to understand the risks and strengths of those youth, and perhaps more importantly, or most importantly, the kind of interventions and policies that would advance public safety and would reduce risks for future offending. So that was the context in which we began the study, and Rob is going to talk a little bit in more detail about exactly what we did and how we designed the study itself.
Great, thank you. So I'll quickly talk about methodology, and then we'll spend the bulk of our time talking about findings and recommendations. So our methodology involved legal analysis, data collection and analysis at the national level, state level, and local level, all the best practice social science research, and then also a pretty extensive set of stakeholder interviews. In terms of legal mapping, as Lisa just indicated, there have been so many laws put on the books in Illinois over time related to sex offenders. It was really quite a task just to map out what they were, what they meant, how they applied to youth. And that was a really important part of our work. Then in terms of data analysis, we looked at national data, all the available data on youth who sexually offend. We looked even more in depth at Illinois data using our law enforcement criminal history database, the database that tracks kids' admissions and stays in detention, and as much probation data as you're able to find. Finally, data on kids who are committed to our state youth prison system and released onto parole and aftercare. The other important thing we did with the data analysis is we looked at actual files to get a better picture, not just of what the offense was in terms of it being a criminal sexual abuse or a sexual assault. We also looked at the files to get victim information, relationship to the victim, actual behavior, in terms of what was involved with the offense. And that really provided a rich set of data that we were unable to find, at least for Illinois, any other way. We also spent time looking at, the research, what's been published nationally. There wasn't much that was published specific to Illinois, but the national research, both for supervision and treatment and assessment. And then we did a lot of stakeholder input interviews to get advice and the input from a wide range of practitioners, from victim advocates to probation officers to judges to treatment providers. So we really had a wide range of folks involved in that. And that brought us to a set of findings which Lisa and Judge Timberlake will present.
George.
There we go.
Finding one, as you see on your screen, was simply that the number of youth arrested for sexual offenses in our state is very small. Keep in mind that Illinois is a relatively large state, 12.88 million people in our state. And we looked at 4 different time frames, 2004, 2006, 2008, and 2010, to determine whether there were any trends, but also to see whether there was any consistency. What was consistent is the numbers were small and declining. From 434 arrests of those between the age of 10 and 16 for sex offenses. So these are arrests, remember, in 2004, and those declined by 2010 to 232. So not only is it that the number is tiny, it is that there is no epidemic of juvenile sex offenses. There is not a frightening state of affairs that requires some very strong and negative attention. On the other hand, 232 arrests, those cases can be very difficult and complex, and they have lifelong consequences for victims. We don't want to diminish this concern for the victims of these crimes, and they have lifelong consequences perhaps for those victims, but they certainly do for offenders and the families in which this activity takes place. It also means, however, that because the number of cases are so small, that we can actually get this right. We can treat each youth as an individual, making risk-based decisions and providing good services and supervision. It's a small number of cases. We ought to focus on that and also focus on the fact that we can do something about the risk to the population.
Finding 2, our second finding that in Illinois, and we believe this is consistent with other jurisdictions and consistent with the national research, the majority of youth arrested for these offenses and involved in our justice systems for sexual offending, these youth are very, very young. In Illinois, half of our population of youth who were arrested for sex offenses were 14 years old or younger, with 1 in 8 of those youth being 12 years old or younger. We found sexual abuse victimization rates based on the national research from 30 to 46% of prior victimization rates among youth who are now being brought into the system as offenders. We also found in Illinois specifically that 95% of the youth arrested for sex offenses were boys, whereas males comprise 78% of other juvenile offense categories. And last but not least in this sort of demographic profile, we found that 51% of the youth arrested for sex offenses are white in Illinois. So the really stark racial and ethnic disparities that we see in our juvenile justice system in Illinois is somewhat less pronounced when it comes to sex offenses. The reason we think this finding is important is that it guides us to think very carefully about adolescent development. Not only the role that adolescent development and the immaturity, impulse control, decision-making difficulties that adolescents have in general may play a role in the offending behaviors themselves, but adolescent development also becomes very important when we think about opportunities for positive behavior change among youth who have committed sex offenses. The other issue that we think the young age of juveniles in our system raises is the really critical role that families play. Judge Timberlake alluded to the fact that families certainly have a role in the offending behavior and in the context that may give rise to the offending behavior, and they certainly have a role to play in the kind of positive changes and risk reduction strategies that we're going to be talking about. The final thing that we really wanted to draw attention to when we were talking about the fact that these youth are very young is the fact that when we then talk about the kind of collateral consequences to being adjudicated delinquent for a sex offense, it's really important to remember that these very distinct and very severe collateral consequences are being attached to children and youth who are very young. Again, half of our youth are 14 or under, 1 in 8, 12 or under. So thinking about the lifelong consequences of sexual offending becomes important when we think about the age of these youth in our system.
Finding 3 gets us to what happens after a kid makes his or her way into the Department of Juvenile Justice, our juvenile prison system. You know, the initial takeaway is, again, that it's a tiny number of kids. And if you look at the number of admissions, they are 2% in average over all 4 years, but in new commitments, they are only 3%. So if you look, however, at the average length of stay in these facilities for sex offenses, it averaged about 19 months, whereas all other offenses is about 7. So these kids stay inside a locked prison facility for almost 3 times as much as their other compatriots for all of the other kinds of offenses. So why is that? It's both the front end and the back end. On the one hand, the Department of Juvenile Justice staff tell us simply that they get kids that don't need to be there. So they are low risk, their offense categories are not high, and the factual basis for that charge and the conviction are understandable in developmental terms. So partially that's a result of a lack of understanding, not just at DJJ, who doesn't determine who comes to their doors, but a lack of understanding in the field in general. So this study aimed to discover what numbers we're dealing with, what risk levels they were, what ages the kids were, and what threat to public safety was created by their acts. Unfortunately, people up and down the continuum of the juvenile justice system simply fail to understand that it is a low risk and that not every kid who is convicted of a sex offense is convicted of a deviant sexual fantasy and danger to the community. That kind of information needs to be explained to everyone in the juvenile justice continuum, and that's one of the reasons we did this study and one of the values of it. On the back end, we find that kids don't go home as early as other kids in DJJ facilities for a number of reasons. Some of them are the application of adult kinds of requirements on juveniles. So if there's a family victim, then that kid can't go home to that family, no matter what the status of the victim's needs or the family's needs. So an alternate placement has to be found. In terms of private placements, 2 problems. For a private family, that same kind of misunderstanding or lack of individual case information prevents foster families, private placements, and non-specialized treatment facilities from accepting these kids. On the other hand, for those who actually need treatment at a higher level and therefore should be released to a residential treatment facility, there's 2 problems. The first is there aren't enough beds, and those who are committed to those facilities stay there an inordinately long period of time also. We have treatment providers who tell us, I've got a kid here who's here for a minimum 9-month treatment program, and he doesn't need to be here at all. That clogs up that end of the system. That plus a very limited external placement resource to the Department of Juvenile Justice in terms of how to pay for those kids is quickly eaten up. It's $100,000 a year to place a kid in DJJ. It's also $100,000 a year to place a kid into a residential treatment facility for a treatment program of 1 year. That means the dollars aren't there, but the big deal is that the understanding isn't there of the use of this prison facility.
Finding 4. In Illinois, again, as in many states, most states, the kind of charges that are applied to youth are the same charges that are applied to adults in the criminal code. In Illinois, there were 4 broad offense categories, or 4 broad offenses, into which most of the youth charged with sex offenses fell. 89% of arrests in Illinois for youth charged with sex offenses fell into one of the 4 charge categories you see on your screen. 92% of detentions and 95% of DJJ admissions fell into one of these 4 charges. The reason we think that's significant from a policy and practice and even a reentry perspective is that these charges, each of these charges encompasses a very wide range of behaviors, a very wide range of situations, and a very wide range of relationships between youth and offenders. But once lumped into one of those categories and once adjudicated delinquent for one of those charges, then the collateral consequences are applied categorically, again, based on the charge versus based on the individual circumstances of the behaviors of the offenses adjudicated. And that means that charging decisions become especially crucial for sex offenses. Those charge decisions made, of course, by prosecutors at the beginning of the case. And those charge decisions, as I mentioned, can have lifelong collateral consequences. In Illinois, there's currently no discretion for judges, prosecutors, treatment providers, anyone. Once a youth is adjudicated, the collateral consequences of registry and the other kind of restrictions that we'll talk about in a little bit, those attach to the youth based on the charge adjudicated, not based on the individual circumstances. And we even, in the stakeholder interviews that Rob mentioned earlier, we heard from a lot of people about the difficulties this creates in reintegrating youth back with their communities successfully. We even heard from some prosecutors that this categorical application of consequences based on the charge affects the way they think about that charging decision at the very beginning of the case when they don't know necessarily what a youth's success or challenges in treatment might be. And so we even heard from prosecutors that these kind of collateral consequences based on these charges may present challenges to them in administering justice and charging and handling cases in the most appropriate ways.
Finding 5 may be the most important finding for the general population, and that is that most youth sexual offending involves a family member or a person known to the youth. Let's take a look at these graphs to illustrate just how overwhelming that relationship is. For the slide on the left, rather the graph on the left, the relationship of probation youth to the victim. And here from our individual reviews of probation files, we had 179 of those. And in that instance, we see that a family or a relative victim is 62% of these charges. A family or a friend is 12%. A neighbor is 11%. An acquaintance is 5%. We're not trying to say that in those categories that's not meaningful negative conduct. What we are trying to say, however, what we discovered is stranger victims amounted to only 3% of these crimes. And those may very well be the very highest risk kids and those for whom we need to take a more surveillance strategy. On the other hand, for the rest of those, if you look at the cases individually, you determine that there are not excuses, but explanations for much of this conduct, namely developmental conduct, over-sexualization from media stimuli, the family dynamic in which this kid lived. That kind of information should change attitudes about who are juvenile sex offenders. Again, not to diminish the conduct and not to deny that there are some kids, some tiny number of the tiny number, who really do require extreme supervision and high-level treatment. If we look at the Department of Juvenile Justice statistics on the right, we see the same kinds of dynamics in terms of family or relative victims, those of a family friend, a neighbor, an acquaintance. Higher percentage for stranger victims, and that's appropriate in a prison facility. We can understand that. On the other hand, there's 17% of that population for which we had no data to determine who the victim was. And we suggest that it's likely to be the same kind of profile of those for whom we did have information. Here's a catch in this entire understanding of who the victims are, and that is people inside and outside the system don't understand, don't know this information. So when we talk to the Prisoner Review Board, our parole agency within the state of Illinois, as to what their attitudes were, their understanding was not only the law, but the dynamics of juvenile sexual offending, we had responses like, these kids are dangerous. This is why we must keep them on parole for as long as possible. We have to keep people safe. It's difficult to have that kind of a conversation when we know the rest of these findings, namely that treatment is extraordinarily successful, that reoffending is extraordinarily low. We'll get to the rest of those. But the point is, without understanding the dynamics of juvenile sex offending, we may well be creating more criminal conduct rather than reducing it.
The sixth finding we presented in our report to the legislature is just what Judge Timberlake introduced, the finding that most youth who have committed a sexual offense are very unlikely to repeat that behavior and very unlikely to become adult sexual offenders or predators. In many ways, this is the crux. This is the message that we think policymakers need to understand. And the concern that we had at the very beginning of the study was that policymakers did not, in fact, understand this. When we began the study, as we mentioned earlier, it came out of a legislative mandate. That legislative mandate actually came out of the fact that there was a series of bills pending that would have further restricted youth who had committed sexual offenses from going back to school, from being present in public parks, from being in other places that there may be children. And while that legislation, pending legislation, was very well intended, it was based on the assumption that youth who have committed one sexual offense are very likely to go on to commit more and to become adult sexual predators. And so when we looked at the national research, and I know that there will be an opportunity to dig much deeper into that research in Chris's portion of today's webinar, we really summarized that research for policymakers, which shows that that assumption is not, in fact, valid, that youth in the justice system for problem sexual behaviors present overall lower risks than youth who are in the system for other offenses. We presented a series of studies as well as the meta-analysis that you see referenced on the screen showing an average sexual recidivism rate of 7.1%. So we really tried to summarize and present this research. And again, the stakeholder interviews that we conducted in Illinois proved important because when we talked to people on the ground, whether they worked in our child advocacy centers as first responders to allegations of sexual abuse, when we talked to probation officers, when we talked to DJJ prison personnel, for example, they corroborated that many of the youth that they see in their system do appear to present lower risks. They may present needs in family functioning, in just developmental status that need to be addressed in some way, but overall present low risks of future reoffending. In fact, as the research and literature tells us, and we have presented to the legislature, in many cases, because of a youth's developmental status, opportunities to grow and learn and to choose healthy behaviors may in fact eliminate or nearly eliminate the already low risks that youth overall present.
Our finding 7 really supports that kind of an approach to those who do sexually offend. So risk-responsive treatment is in fact not only effective but appropriate. So in other words, we have tools such as the JSOAP and eraser, which can adequately reflect the risk that a child displays for reoffending in the future. Just as we have tools that measure risk for general juvenile delinquent behavior, we have that specifically for juvenile sex offending. So based upon that risk factor, it is entirely possible to develop an individualized supervision and treatment plan based not only on what the child did, of course, but what are the circumstances in which the crime took place and in which the kid lives his daily life. Community-based interventions are effective, and the literature certainly supported that. Studies support that. It must be provided by skilled practitioners, of course, but the need to maintain a kid in a locked facility when his risk for reoffending is low and when the conduct for which he was convicted is understandable in some sense, at least is understandable in the sense of his developmental age, the circumstances of his family, that can be provided in a community setting as opposed to a prison setting without additional risk to the public. And finally, that comprehensive, family-focused, evidence-based treatment, such as multisystemic therapy for problem sexual behavior, gets at the root of the situation in which the kid offended. In other words, if it's family-based, if it's a family or a relative or a friend or a neighbor who is the victim, that circumstance must be treated as much as the kid's individual behavior or belief systems. So we have effective treatment. And given that recidivism is lower than other offenders in general, we can reduce that to a minuscule risk to public safety.
Our 8th finding relates to Illinois' statutes and practices of placing youth on registries as sex offenders. And our finding is that the current youth registration practice and policy in Illinois does not enhance public safety and in fact can undermine treatment and positive outcomes. The slide you see really documents something that surprised many policymakers and many people that we have talked to about this study since its release. The first graph on the left of the slide shows that despite the fact that what we mentioned at the very beginning, that the number of youth being arrested and adjudicated for sex offenses, despite the fact that that's fairly small and appears to be decreasing over time, the number of youth or the number of individuals on our sex offender registry as a consequence of being adjudicated delinquent is growing. And when you look at the right side of the screen, you can see why that is. 70% of the juveniles placed on our sex offense registry are placed on with lifetime registry requirements. And the remaining 30% have a 10-year registry requirement. That surprised a lot of our policymakers that so many young people were being placed on the lifetime registry. In Illinois, we do have, in the last, I think, 6 years, we've had a component of our statute that allows youth to petition, some youth, to petition to be removed from our sex offender registry, but we've found very, very few instances of that actually occurring because of the complexity and the cost to petition a court to be removed from the registry. So this 70% lifetime registry requirement is quite significant and was quite surprising. When you take a look then at the question of whether these kind of registry and collateral consequences, whether they work or not, we found very little compelling evidence in the research that these kind of categorical approaches to requiring youth to register and prohibiting youth from, again, engaging in school, having certain jobs, using technology and computers, being required to tell people in their communities, in their schools, or law enforcement actually informing people in their communities or their schools of their juvenile records. We found very little compelling evidence that those kind of approaches had been proved to enhance public safety in any way. And I think when you really think about the way that many states approach registry, you can understand why. When registry is categorical, again, based on that charge, as opposed to based on individual circumstances or risk, we may have people on registries who at the beginning presented quite low risks. In Illinois, as in many states, being on the registry does not come with additional services or supervision that might in fact reduce or contain risks. It just means registry. Being on the registry comes with significant stigma and shame. As I mentioned, the requirements of public notification or notifying your college or your school of these, of your registry status comes with a lot of understandable shame and stigma. And again, if youth are on a registry for life, we also found evidence that that provides very little incentive for the kind of positive changes and positive behaviors that we might expect to reduce risk. And then on the other hand, the registry and collateral consequences and restrictions on what young people can do in terms of school, employment, and so on and so forth, those create very real barriers to the kind of things that we want young people to do, to be healthy young people, and the kind of activities and services and supports that would actually reduce risks of reoffending if they were present. And finally, in the report, we talk about the very serious lifelong consequences of failure to comply with these really complicated and increasingly complicated registry requirements. In Illinois, failure to comply with registry requirements can result in a felony conviction. As an adult, most of the youth are over 17 if they face a failure to register charge. So we've got adult felony convictions that then become matters of public record. And so all of the vestiges of confidentiality of the juvenile court, any remaining vestiges of confidentiality are stripped away if there are failure to register convictions. And last but not least, we found that it's incredibly confusing for people to understand what their registry requirements are and to comply with those. Again, when we mapped out, what the state of Illinois law was on registry, we found a lot of confusion even among legal professionals who said it's very difficult for them to advise youth on probation or advise youth on parole who are reentering their communities what they're supposed to do. And in our system, and again in many places, you don't have a public defender at this point. Your case is closed and you have to figure out how to comply with registry on your own or if you can access legal aid. So for all of these reasons, including the very persuasive national research, our finding is that this kind of categorical registry of young people as sex offenders is not proven to enhance public safety and in fact can undermine the kind of positive behaviors and positive outcomes that we want for both young people and victims of sexual offending and our communities. And one final note on this finding, when we think back to what many of you on this webinar know and knew, when we think about the fact that victims are very often in the homes and in the families, when you've got these sort of public notification and registry requirements, it has an inevitable negative impact on the victims themselves. So while policymakers never intended to stigmatize or shame or create problems for victims of sexual offending or their families, in fact, we think that's what some of these categorical consequences and registry requirements are doing. They're harming the very victims that they were intended to protect. So those are our 8 factual findings in the report, and I believe we're going to turn now to what our policy and practice recommendations are based on those findings.
I think we've got about 5 minutes, so I'll quickly cover our 3 recommendations. The recommendation that we have on the slides here is the kind of high-level statement. If you go to the report, and we'll provide you a link in a second, you'll see a lot more detail about what is included in these recommendations, what we mean, how it might be implemented. So our first set of recommendations are around standards and training. Essentially, we don't think there are clear practice standards for professionals who assess youth, for professionals who provide treatment, for the courts in making decisions, or for probation officers or other community corrections professionals who are supervising youth. So we really need standards and training on those standards for all of those groups of people. The second one really flows out of that first recommendation, creating and making more available interventions that we know that to be effective in communities across the state. As one example, a lot of the research has been really compelling about multisystemic therapy and its use for youth with problem sexual behaviors came out of Cook County here in Illinois. Unfortunately, that resource isn't available even in all of the county, let alone in the rest of the state. So geography really determines what effective interventions are available. And then finally, Lisa just laid out the issues that we found with the registry. Our recommendation is to remove young people from the registry, in particular so that the categorical restrictions and collateral consequences don't apply to them. We know this is sort of the highest attention-grabbing recommendation that we made, but we really think that the best way forward is to end the sex offender registry as it currently exists, which is so problematic for young people for such a long period of time. Here's the link to access the report. It's a substantial report. We hope that it's interesting to many of you and that you go and take a look at it. Before we go, though, I wanted to highlight 3 quick things that are takeaways from the report in terms of reentry in particular. One that Judge Timberlake talked about is the long stays in correctional facilities. And a lot of those long stays are necessitated by the need to find a certain type of placement to fulfill the sex offense registration requirements. Secondly, the importance of treatment. It's a low rate of reoffending overall, and it's lower still when evidence-based treatment is provided. So is it available everywhere across the state? And then third, the impact of registries and restrictions, the barriers that are created, the long-term consequences. Housing is impacted, education is impacted, employment is impacted, the ability to walk down the street in your community is impacted for a long period of time. Again, 70% of these cases, it's for life. And I'm sure there are many other implications for reentry from the work that we did, but I think those are kind of the 3 highlights. And with that, I think we'll turn it back to Cynthia and Chris.
Thank you to our presenters, Lisa Jacobs, Robert Vickery, and the Honorable Judge Timberlake for sharing your valuable experience and insight. And now we'll turn to Mr. Lobanov-Rostovsky to discuss the research on juveniles who commit sex offenses. Thank you, Mr. Lobanov-Rostovsky.
Thank you, Cynthia, and you are doing very well with pronouncing such a difficult last name. I appreciate that. First of all, in terms of moving from the discussion in Illinois to some of the work nationally, I would really like to commend and congratulate Illinois Juvenile Justice Commission and the work that they've done. I think Rob started out by saying that they didn't have a high level of knowledge in this field, but I think their presentation would certainly suggest otherwise. It seems like they've done a very thorough analysis of the work, and that much of what they've identified in Illinois certainly is seen also in national trends as well. So I'm going to spend a few minutes here talking a little bit about some of the national research. Here's my contact information, and I see in the chat box that these slides will be made available to you by PDF later, so you don't have to frantically write down Lobanov-Rostovsky. I like to often point out that it is, of course, the common spelling of Lobanov-Rostovsky, so it shouldn't be a problem for you all. But anyway, feel free to contact me offline if you want some more information related to this presentation or just anything in general. And there is the Colorado Sex Offender Management Board website there as well, too. So if you're interested, Rob talked about wanting to do juvenile standards for care for juveniles. Colorado has done such standards. So if you're interested in looking at those, they can be found at that website. You're more than welcome to use those in any way that would be helpful for your jurisdiction. And then finally, I would like to thank the Center for Effective Public Policy and their project, the Center for Sex Offender Management, CSOM, for some of these training materials. I've worked collaboratively with them, and CSOM is a great resource, so I would really encourage you to go and take a look at their materials. In terms of some of the national trends related to sex assault, what we saw prior to the 1980s was really not much identification of youth committing sexual offenses. I don't think that this means the behavior wasn't going on. I think it's just that it wasn't rising to the level of juvenile justice awareness, detection, and identification. And then in the 1980s, we saw several pieces of research being done on adult sex offenders where adults were saying, you know, gosh, I started this behavior as a juvenile and nobody ever did anything about it. And this led, I think, the field to begin to say, well, if we could start working with these youth, maybe we could prevent future adult sex offending behavior. And that's sort of how I think this field really got started. And so what we've seen since that time is fairly steadily about, you know, this number of sex crimes going on, roughly about 9,600 a year. And in terms of what percentage of juvenile to adult sex crimes, roughly about 1 in 5 to 1 in, maybe 1 in 6 to 1 in 7 sex crimes are committed by youth as compared to adults. So we've seen this dramatic change within our field and within the juvenile justice system, where we're now identifying youth as having committed sex offenses, and we're seeing some of the outcomes that the contingent from Illinois described. And I think early on in our field, what we were doing was really using adult models of care to deal with this population, thinking that they were sort of like little adult sex offenders or future adult sex offenders. And so we were using the same models of treatment, and I think we have discovered over the years in terms of our research that juveniles are very distinct from adult sex offenders, and therefore they need unique intervention strategies, treatment, supervision, registration, et cetera. So I think that's what we've learned as a whole, kind of the take-home message from our work in the national literature, which again I think was replicated and discussed by the folks in Illinois. They cited one meta-analysis for you from Michael Caldwell. I will highlight one other meta-analysis by Reitzel and Carbonell with similar findings. And what they found, I think the two takeaway messages from this, number one, is that if you look at sexual recidivism versus other types of recidivism, it seems like the greater concern is for non-sexual recidivism. Now, certainly, we're looking at about a 12.5% sexual recidivism rate. So somewhere between 1 and 2 out of 10 youth who have committed sex offenses then will go on and commit another sex crime, but the rates for other types of crimes are typically seen as higher. And so I think our interventions really need to be more holistic in terms of not just focusing on the unique aspects of juveniles who commit sex offenses, but also looking at the potential for other types of offending behaviors, and that perhaps they share some things in common with other types of juveniles involved in the juvenile justice system, rather than sort of a carve-out unique population. As was highlighted by the Illinois study as well, treatment efficacy is also demonstrated, and it's been demonstrated more consistently and at a higher rate, I think, than with adult sex offenders. I think the adult sex offender field tends to focus more on helping adults to learn to manage sexually deviant impulses in many cases, whereas with the juvenile treatment, it seems like, as was indicated, that it's possible to really provide treatment and hopefully help a youth to move beyond sexual offending behavior. So I think that's sort of the two takeaways, and I would encourage you to look at this or any of the other meta-analysis to look at the factors related to recidivism. This study, I think, is significant as well, too, because it's done by Jim Worling and colleagues, and Dr. Worling is the developer of the eraser that Judge Timberlake referred to, one of the risk assessment instruments, and he has actually followed his youth over a 20-year period. Now, granted, the N is relatively small, but he's found fairly consistent results as he's done this at 5, 10, and now 20 years, where, again, the two takeaway messages. Number one, that non-sex recidivism seems to be higher than sex recidivism, and that treatment reduces in all categories the level of recidivism, so suggesting that treatment can be effective with this population, perhaps more so than with the adult sex offender population. So I like to show this just because I think to see a 20-year outcome study certainly also brings the takeaway message of that it's unlikely that most of these juveniles who commit sex offenses will continue this behavior into adulthood. And that was sort of the original premise by which we started back in the 80s, and I think we found that that premise is perhaps false to a large degree. Although, again, I don't want to minimize the fact that there is this level of recidivism that we need to attend to, and certainly put intensive resources in place for that specific subset. But to put the same level of resources, a high level of resources into all youth may be unnecessary, may cause iatrogenic effects with these youth, and may be a waste of resources as well. Here are the three instruments that are typically used. This is, I know, very rudimentary perhaps for some of you, but just to give you an idea, the two instruments on the outsides, the eraser and the JSOAP2, are both clinical judgment tools. They are not actuarial risk assessment tools like we see on the adult sex offender side, but they both have had a number of validity tests done to show fairly good validity in terms of predicting at least recidivism in the short term. Based on the results that Jim Warling has seen in his validity studies, he suggests that really the eraser is only good in terms of predicting recidivism perhaps for up to 2 years, and not when a youth moves into being an adult. So I think we need to be constantly sort of rescoring youth on risk assessment, given how much is changing within youth, developmental processes, et cetera. So it's not like you can score a youth at age 12 on an eraser and then at age 22 that risk is the same. So the eraser and the JSOAP, these instruments, the percentages talk about how much these instruments are used. It's not talking about the validity or which is the best. So just because the JSOAP is used by 60% of providers doesn't necessarily mean it's the best, but these are the most widely used. The JSORAT is an actuarial risk assessment instrument that was developed for use in certain states. However, it is not validated in any other states, and therefore can only be used in limited circumstances, thus the reason why less practitioners, I think, are using that. So again, I think if you're seeing results from the eraser and the JSOAP, or in a state that's validated the JSORAT, seeing results from that tool, I think you're in good shape. There are also, as Judge Timberlake indicated, other tools for non-sexual recidivism, such as the LSI and other tools that can be useful for this population, given that we're concerned about non-sex reoffending as well. Here are some of the risk factors that Warling and Langstrom have found. They did a really good summation of the literature and what factors have been supported in research studies, and these are the ones that they came up with. And the one comment generally I would make about this is just that many of these are things that you would also see as risk factors both for other types of delinquent activities, and so for general criminal offenders who are juveniles, some of these factors may contribute to future juvenile offending on their part. These are also factors, I think, that we see in adult sex offenders as well. So there may be some commonalities in terms of the risk factors. So in other words, those youth who have those characteristics that are more like adult sex offenders and have those risk factors, those are the ones we want to be concerned about. So there is some crossover, although there are a couple here that are unique to youth, such as family instability and poor parent-child relations. Those are ones that are unique to youth. You know, association with delinquent peers unique to youth, but obviously association with adult criminal peers and associates is also a problem for adults. So anyway, I would draw your attention to those. These are the types of things that we want to be looking at in terms of where to put our resources, what level of intensity of services need to be in place by doing the risk assessment instruments and looking at risk factors such as these. In terms of where we are as a field in terms of treatment right now, I think we've come fairly full circle. We're no longer advocating the use of adult sex offender models for treatment. We really need to be doing treatment that is geared for youth developmentally, cognitively, and addresses their unique treatment needs and risks. We know that there are different types of youth. Not all youth who commit sex offenses are the same. Some may have more in common with other types of delinquency offenders, and so these are things that we need to be incorporating into treatment. And I think Lisa talked very eloquently about the labeling and the potential damage that a label can do in terms of some of our other policies. And so I think it's important, given what we know about recidivism and risk, it's important for us to think about how we're going to be referring to these youth and what we're going to be doing in terms of future registration, et cetera. So youth need individualized treatment planning. A variety of treatment modalities, group, individual, and family systems can all be appropriate. Several speakers mentioned MST as one possibility related to that. I think cognitive behavioral interventions have also been shown to be fairly effective, as well as a number of other evidence-based treatments out there. So we know a lot, I think, at this point about what does work in terms of treatment. And we also know what doesn't work, and that is sort of these punitive approaches or heavy confrontation approaches that perhaps were more the benchmark of adult sex offender treatment earlier in the day, are things that we're not recommending at this point in time. In terms of supervision, what we know about supervision is that supervision, for it to be most effective, really needs to be in conjunction with some type of a rehabilitation orientation, so some type of treatment. So just to supervise and contain and control somebody from the outside, we know is unlikely to change their behavior, certainly beyond the end of supervision, perhaps not even during supervision. We know that punishment in and of itself does not lead to behavior change. We really need some type of a rehabilitation orientation. And so I think it's important that whatever policies are developed from a supervisory perspective also include a rehabilitation component, whether that's within a youth corrections facility, within supervised probation, et cetera, that the best results, the literature says that the best outcomes are those surveillance, monitoring, and treatment approaches that sort of balance all three of those. And in terms of then addressing the specific youth, I think the judge or one of the speakers referred to it as sort of a risk responsivity model, certainly addressing the individualized risk of the individual youth in terms of the supervision orientation as well as in treatment is appropriate. We know that over-intervening with low-risk youth actually can make youth higher risk. So back when we first started, it was sort of an everything but the kitchen sink approach, and we've realized that that's not the best approach, that not only is it not sort of a neutral thing, it actually may be a detrimental thing. And so we really want to have individualized treatment based on the risk level and the needs that the specific youth are presenting. We also know that if you congregate low-risk youth with high-risk youth, that low-risk youth actually, their risk level can also be aggravated as they model after adult or after higher-risk youth. So that can be a problem for youth corrections facilities where there's a mix of low and high risk. So really maybe attending within those facilities to somehow segregating youth, if not in the facility, maybe at least within interventions, I think could be helpful in that regard. And then need I've referred to, again, targeting the specific needs. We often refer to those as dynamic risk factors, what things can be changed that are connected to and correlated with future offending behavior. Those should be the targets of our supervision as well as of our treatment. And so probation officers, parole officers, et cetera, really need to know what those specific dynamic risk factors or criminogenic needs is often how it's referred to as well, what those needs are. Here is, it's going to go one at a time. I apologize for that. Let me just get them all out there. Here is some differences in approach, looking at it more from kind of a surveillance accountability approach versus that a balanced approach of accountability as well as focusing on rehabilitation and needs. And so you see that for a supervision officer, that they really view themselves as part of being an agent of change and helping youth to change and develop pro-social activities, pro-social supports, et cetera. Those things are really crucial for the rehabilitation of the youth, and if we put restrictions in place and labels in place that prohibit those avenues from being explored and from those things from occurring, we're actually sort of cutting off our nose to spite our face. And so we really need to do things that allow for those things to occur in a safe way, suitably safety planned, et cetera, so that youth can have the opportunity to reintegrate back into their communities, move on the developmental trajectory that they should be on, engage in pro-social behaviors with pro-social peers, et cetera. And so the supervision officer really should be oriented and focusing towards those things. Those things are often referred to as approach rather than avoidance goals. And so focusing on those approach goals, things that we want the youth to be doing rather than don't do this. As soon as you tell someone don't do this, what's the first thing they want to do? Well, they want to do it. Whereas if you say, here's the things that I think would be great, or better yet, I'm not telling you what to do, motivational interviewing, let's work together to help figure that out and see what you want to do, hopefully helping them to identify those positive approach-oriented goals can be very helpful for the supervision officials that are working with these youth. The final thing that I'll say, and then we're going to open it up for some questions here, is I would like to also refer to registration as well, and just to say a few things really quick in terms of the research on this. There was no requirement for juvenile registration up until the Adam Walsh Act in 2006. The Wetterling Act of 1994 was passed and required states to do adult sex offender registration only. However, some states, it sounds like Illinois was one, Colorado was another, some states have done juvenile registration even though it was not a requirement. Basically, the way the federal mandates work is they're considered a floor, not a ceiling, so you can certainly go above them. You just can't go beneath them without suffering a financial penalty in terms of some of your grant funding, and that's the way the federal government gets states to enact certain laws. So there was no requirement. Many states did not do juvenile registration. As of today, about 1/3 of states have juvenile registration, or 2/3, excuse me, have registration. About 1/3 make that information public. So there are still 1/3 of states out there that don't register juveniles at all, and 2/3 that don't make that information public, both of which were a part of the original Adam Walsh Act. The SMART office is the office that's responsible for states implementing sex offender registration, and they've backed away from requiring states to make that information public. So what we know, though, is that many states have not enacted the Adam Walsh Act because of the juvenile registration requirement. So I think there's that line in the sand that many jurisdictions have drawn saying enough's enough, we feel like this is going too far. And as indicated, the research related to the change in recidivism for juveniles who commit sex offenses based on registration and notification, there is no research to support that there is any change in juvenile behavior based on, or any maybe positive change in behavior as a result of being registered and notified on. And what we do know is that that certainly can enhance social isolation and can lead to things like going back into the criminal justice system under a failure to register charge. So many states are doing what Illinois is in terms of looking at that, given what the research is saying about that. So I think with that, I will turn it back over to Cynthia.
Thank you, Mr. Labana-Verstovsky, for sharing that research. And now I will turn to the questions we've received for our panelists. So the first question is for all of our presenters. If the recidivism rate is so low for this group, why is the length of stay so much higher for this population than for youth who have committed other offenses?
I think what we've seen in Illinois in particular is primarily the restrictions required of youth once they're released into the community are so arduous and difficult to meet in terms of not living in the same house as a child, et cetera. There's really a challenge at getting kids out the door to an approved placement.
I think another challenge we've seen in working with the treatment provider community is, and also in working with people who operate detention facilities, or in particular DJJ facilities where youth have that exceptionally long length of stay that you saw in the Illinois slides, we've heard about the difficulties of youth returning home. That once youth have been removed from their families, again, given the likelihood that the offending behavior, that the victim is in that family and in that home, if we have not offered support to that victim, if we have not offered support to that family, if we have not engaged in community-based work with that family and the youth around what occurred and how to strengthen their abilities to prevent reoccurrences or reoffending, that family is sometimes very reluctant or unable to have a youth come back home successfully. And so when we think about the problems and the challenges to reentry, the idea that if we take a youth out of a family where the victim also lives and put that youth somewhere else, that's good for families, it's good for victims, has proven not to be accurate, either in the research or in the perspectives of stakeholders. So I think that the short answer to that question is, for all youth involved in the justice system, but particularly for youth who are involved for sex offenses, removing them from the home for long periods of time just creates huge obstacles to returning home successfully, both legal obstacles, practical obstacles, and also relationship obstacles.
If I could add one thing, this is Chris. The other thing that I would add, because we see this also in residential treatment in addition to youth correction facilities, and I think, again, part of this might be that remnant of an old model of treatment, thinking that this needs to be a very long-term, intensive model of treatment for all youth, and also perhaps some expectation that treatment be successfully completed before a youth is able to step down in care. And what we've tried to do here in Colorado is to say that there needs to be a continuity of care. So you go to a residential facility or to a youth correction facility, you gain stability, you learn basic skills and tools so that you'll be able to cope and manage on the outside, and then we move you into a community-based setting with follow-up care so that then the youth can be using some of those skills in the community and receiving follow-up treatment and actually successfully completing their treatment in the community. So I think it takes a change in policymaker expectation. Rather than expecting a successful completion, expect a certain level of stability and readiness to move to a lower level of care.
I think there's also both a process and an attitudinal factor involved in the disproportionate lengths of stay. One of those that we discovered in our study in Illinois was simply that even when the Department of Juvenile Justice recommended release on parole, the Prisoner Review Board, the parole agency, often took the attitude that no juvenile sex offender can be safe, so we will not release that child on parole until the last possible moment. And in Illinois, where parole for juveniles can last until age 21, that can be a very long time indeed for kids who were offenders at a very young age. That information gap for the release authorities and the process that we must go through, and of course it's different in every state, but it's still that attitude of we're afraid of these kids, and so they cannot be released.
Thank you. Our next question is for Mr. Lobanow-Verstovsky. If we're implementing screening tools for adults in our jurisdiction, can we apply these tools for juveniles?
I would strongly encourage anyone not to do that. I think that any tools for adults would not have validity for juvenile populations unless they've been normed on that population. And so I think there is a need for juvenile-specific tools. There are tools out there, such as the eraser, the J-SOAP, and the LSI, that can be used with youth. I think that it's a real challenge for folks to be able to assess this population as they're moving through the course of their adolescence and into adulthood even, because again, the manufacturers and the developers of the juvenile risk assessment tools are saying don't use these tools when someone is now an adult. And so if you have someone who's being assessed as an adult based on a juvenile adjudication for a sex crime, it's a real challenge in terms of what tools to use. But I would really strongly encourage people not to use any specific tool that has been developed and normed on an adult population with someone who either is a juvenile now or even was adjudicated as a juvenile and is now an adult. I don't think those tools are valid.
Thank you. Our next question is for our presenters from the Illinois Juvenile Justice Commission. Given the stigma attached to this population, were certain stakeholder groups in Illinois more resistant to your recommendations than others?
Well, I think the way we have viewed our study and what happens next is to really focus on dialogue. There's no way to use this report and the research findings and certainly the research that Chris presents to force change. If positive change is going to occur, it's going to be a result of dialogue, having conversations with policymakers, and really linking people in the field, again, probation officers, service providers, and others who really knew all of the findings of our study and had hoped that people besides themselves could learn about them. So we've really spent the time since release of the report in March of this year presenting it and talking with lots of different stakeholders. And I think we could not point to any one particular group as resistant. On the other hand, there have been groups of stakeholders who may have been considered unlikely allies. Again, our child advocacy centers across Illinois who work with police officers and prosecutors as first responders in cases of abuse have been very open to dialogue and have said that the findings are very consistent with what they see in working with youth and families and victims of sexual offending. They've been incredibly receptive and in fact have said, we want to help convey this message, which is our message too, the need for more community-based resources, the need for more support for families and for victims. We want to help convey this message to policymakers. On the other hand, and I'm not sure if Judge Timberlake would want to talk a little bit more about this, we've also heard from policymakers that it's going to be very difficult to make the kind of changes we're recommending, particularly around registry. Even when they say that the findings are compelling and they understand them and they agree with them, they believe that public sentiment is going to present a challenge for them as elected legislators in repealing any portion of the registry. So we have work to do. I'm not sure that I would call that resistance. I would call that a challenge. Judge, is there anything you would want to add to that about the dialogue following the study?
Yes, I think so, and I think you're being charitable when you're not describing some of the attitudes as resistance. And I think that's, I don't mean to demean the legislature or other policymakers, but I can tell you that when the study was first released, we had some very positive reaction from some legislators. I revisited with them recently because our legislature is now back in session. That enthusiasm had evaporated. And even though in talking with many legislators and prosecutors and providers that they understood the dynamics of child sexual offending, they were not willing to stand up and say, well, we need to change something about this. Part of that is a matter of lack of information, but part of it is simply policy making based upon fear instead of facts. We see the legislature pass bills that have no sense whatsoever just because there's been some genuine attention to a serious problem in public safety. But the reaction really has nothing directed at reducing that risk. So we certainly have work to do. And the change of opinion, not just for the public, but for the legislature itself, and that change often lags behind a public understanding, it's a great challenge. But it's important to remember that this study points at recommendations, and the state of the field, as Chris has described, it improves public safety. Not only that, it creates positive outcomes for individual kids when treated individually, and if nothing else, both the public and the legislatures ought to understand that it costs less money. And if we're going to have an effective juvenile justice system in general, we have to look at all three of those points: public safety, positive outcomes for kids, and those create public safety, and all of that costs less than the systems we have, which are based upon punishment and incarceration.
Thank you. And again, our next question is for our presenters from the Illinois Juvenile Justice Commission. The demographics of youth who commit sex offenses in Illinois are different from the overall juvenile delinquent demographic. Why does this demographic look so distinct?
Well, I think the most striking demographic that we found, and I believe it surprised many of us on the study team, and it certainly surprises a lot of people we talked to the report about, is that very young age of youth being arrested and brought into the delinquency system. Again, distinct from the child protection side, being brought into the delinquency system and charged as a sex offender. It's speculation on our part, but certainly that young age, I think, represents what we've alluded to, that if youth are charged and brought into the justice system at such a young age, it reflects concerns by those responding to allegations of abuse. And I think it also reflects a lack of alternate resources. And certainly that's reflected in one of our recommendations and in the work that we are trying to do in Illinois. When communities don't have other alternatives, the delinquency system often becomes the default treatment provider, the default public response system, and sex offenses are not distinct from other challenging situations that youth and families confront. So I think that young age was really one of the most striking demographic features. The other sort of demographic element of our population in Illinois is probably very similar to other places, that it's overwhelmingly male. On the other hand, for the small number of girls who are in the justice system, we've seen even more stark challenges for them in getting out. Our girls' prison, for example, when we went to do file reviews, we saw very long lengths of stay for girls who had been sent to DJJ for sex offenses. We think that represents a lot of things, attitudes and values and beliefs around girls who have been identified as having problem sexual behaviors, a lack of effective treatment resources, and again, as Rob Vickery mentioned, the application of adult sex offender standards to their release, whether they can go home. And as a result, we were seeing girls staying a very long time in juvenile prison and aging out without being successfully reintegrated and without having supports provided for them to successfully reintegrate. So those are some of the dynamic or demographic characteristics of our population that we really felt had implications for treatment and public policy.
Thank you. Our next question is for all of our presenters. Given limited availability of services and placement options, how do you propose we work with this population in a way that addresses their unique needs?
Chris, do you want to go first?
Absolutely. I guess when I think about that question, the first thing I think about would be, if you don't have the resources, maybe to figure out a way of how to develop those resources. I know there are lots of pockets of areas where treatment is not available, for example, but are there ways to get those services to those areas? And so I think it's important that the services that we provide are adequate and accurate and good services. And so if that service doesn't exist, then figuring out a way to develop it, perhaps. I think, also maybe talking with existing providers about diversifying, perhaps, and figuring out ways to be able to provide other services that might be needed. So I think that figuring out and identifying what those services are, and I think frankly the marketplace oftentimes will drive the resources as well too. So if everybody sees that there is a need for high intensity correctional care or residential care, that's where the market will go. If there's more of an emphasis on community-based services, then hopefully the market will go there as well too. So I think we need all those levels of care. I mean, there's always a need for youth corrections facilities, residential care, foster home, group home care, and then community-based or outpatient care as well. So we really want that continuum of care, and the more that those resources exist, hopefully the better that youth can be properly slotted into the level of care that they need rather than being placed in an available level of care.
And I think what I would add from the Illinois perspective in particular, and I think I mentioned this earlier, the resources available vary dramatically from community to community, and so I think that poses real challenges to providing those services consistently.
I think that's true, but I also want to emphasize that I live in a very rural part of Illinois, and we have in that area a really good provider for juvenile sex offenders. Now, unfortunately, that means they have to go to that facility because it's located in a very sparsely populated of the state, but it exists. And another one of our both Models for Change partners and our commission grantees is Ogle County, which is far west of Chicago and 54,000 people. And they've developed an extraordinarily good treatment program all on their own. If we look at Lucas County, Ohio, Toledo, they've done a spectacular job of developing community-based treatment facilities. So treatment, not just facilities, but treatment programming that does not require residential care. So it's not impossible. For small populations, it certainly presents challenges, but emphasize, and as Chris said, the marketplace drives it. If the community or state systems emphasize the need for that kind of treatment facilities, treatment programs, and it's very, very likely that some private service provider, not-for-profit service provider, is going to develop some capability in that area.
Thank you. And our last question again is for all of our presenters. Both presentations describe the very low sexual recidivism rate among youth who commit sex offenses. Can you clarify why we think the sexual recidivism rate among youth who commit sex offenses is so low?
Chris, is that something you would want to respond to first?
I'll go ahead and start. I think the one thing we have not mentioned in all of this is that recidivism is detection. And so I think we need to keep in mind that sex crimes are very underreported, and so we may not know the extent of the level of recidivism that's occurring. But that being said, I think, you know, again, that the suppositions that we made early on were that all of these juveniles are going to continue on and become adult offenders, but that those studies were retrospective studies of adults who had done this behavior. So while certainly many of the adults who are doing this behavior may have started as youth, what we didn't realize was that there may be another population, these youth who are not continuing on to reoffend. And so I think we've learned that in terms of, the question is, would they have not gone on with or without our intervention? We may not know the answer to that. But I would certainly also attribute to the fact that we've put some good models of care in place. And so perhaps, we can take a little bit of credit as a field in saying that what we're doing is making a difference and we're intervening and stopping this thing early on. I think it's much easier, obviously, to stop and redirect a behavior and a person when they're 12 than when they're 40. And so I think, that it makes sense in some ways that development is on on our side. Brain research, we haven't really said that, but brain research is on our side in terms of the brain is still developing. Youth are learning about impulse control, empathy, these types of tasks. So all of those things, I think, are contributing to the fact that behavior can change. And that's fairly true what we see across all criminal behavior. It really peaks in adolescence and early adult years and then diminishes over time through the life cycle. And so the fact that sex offending showing similar trends maybe isn't surprising. I think early on, again, we thought that these youth or people who commit sex offenses were, completely different in kind than other types of criminal offenders. And I think what we've realized is that even though there is a uniqueness to their behavior and the types of offending they're doing, that they also share things in common with other criminal and juvenile justice populations as well. So I think we've learned something, and I think, this is what we think we know as of now, again, within the limitations of the research and the data that's available. And so I think as a result of that, we've really changed our thinking and the way in which we're approaching this problem.
So we're running out of time, and I just want to thank our presenters for your thoughtful responses to participant questions and for your participation in today's webinar. Just as a note, as you exit the webinar, a short survey will automatically appear to ask you about your experience on the webinar, and we will use this feedback to improve our services and very much appreciate your taking a couple of seconds to complete the questions that will appear. And again, to receive more information about the latest research, funding opportunities, distance learning events, and other news about reentry, please sign up for the CSG Justice Center's monthly newsletter at csgjusticecenter.org/subscribe. Thank you again to our presenters, and thank you all for attending today's webinar. Have a great afternoon.
Thank you.